I'm so glad you're here today because I want to talk about something that a lot of new moms experience during their pregnancy and after their pregnancy, and that is postpartum depression and postpartum anxiety. It's very normal to have ups and downs in mood during your pregnancy and after your pregnancy, but postpartum depression is an actual condition. It lasts longer than the usual baby blues, and there are ways to improve those symptoms so you don't have to suffer and your baby doesn't have to suffer either. Hi there, my name is Daniela. I am a licensed therapist and I make videos about mental health, personal improvement, sometimes about pregnancy, sometimes about fun, but I try to make my videos really honest and raw and real and practical so you can make use of them and hopefully make changes that are relevant in your life. As I said already, we're going to talk about postpartum depression today. So let's get started with some common symptoms that people present when they struggle with postpartum depression. Those include feeling very down, having trouble bonding with your baby, losing interest in things that you used to enjoy. It can also involve changes in sleep and appetite, as well as feeling guilty and worthless. If you're going through any of these things, I want to tell you that you're not alone and that there are tips and tricks and things that you can do to help manage these symptoms and these emotions. So let's work together to find out what works best for you. There are several things that you can do to prevent postpartum depression, and in a quick Google search you will find this information. I want to validate this information that I have seen online. It is helpful, it's been well researched, and although sometimes it doesn't feel like it's helping, it does help. So the top general recommendations for preventing postpartum depression include getting regular exercise. Exercise has been shown to have a protective effect on mood and help reduce the risk of postpartum depression. Eating a healthy diet can improve your mood and overall well-being during pregnancy. Getting enough sleep can help you feel rested and more able to cope with the stress of pregnancy and motherhood. Staying social, surround yourself with supportive friends and family, and try to maintain social connections during pregnancy. I know this one can be a little hard. I have personally struggled with it during this pregnancy. I just moved to a new country, I'm adjusting to a new culture, new people, and I feel like I just want to be in my nest with my partner and my baby. I don't feel like going out and making new connections. I know that this is very important and I'm trying to force myself to find a mommy community here in Madrid. Seek support. Talk to your partner, friends, and family about your feelings and concerns during pregnancy. You don't have to do this alone. It's best that you express what is in your head, what you're going through, and that you try to find that support and love from people around you. The negative thoughts during pregnancy can be really overwhelming, and not because your brain is broken or anything like that. It happens because your body is entering that survival mode so you can protect you and your baby. So these negative thoughts do have a purpose. They're trying to help you see all possible danger around you so you can take certain measures to protect yourself and your baby. So there is a purpose with all of this negative thinking, but don't dwell on it and don't go through it on your own. If the thoughts are getting too tough, if you feel like they're very intrusive and they're hard to control and to reframe, I recommend that you seek professional help with a therapist or with a coach or with a monk, whoever you think could be a good healing person for you. Practice stress reducing techniques. Find ways to manage stress during pregnancy, such as through relaxation techniques like deep breathing or meditation. All of these things are wonderful, but something that is missing here is the cognitive aspect of your health. Something very important to know is the impact that your mind has over your body. I've learned through my career as a therapist that your mind can really do wonders when it comes to your body and the way you live. And research has shown that your thoughts and emotions have a big influence on your physical health and well-being. For example, chronic stress and negative emotions have been linked to a range of physical health problems such as high blood pressure, heart disease, and weakened immune system. On the other hand, positive thoughts and emotions have been linked with better physical health and a greater sense of well-being. I want to help you engage in an evidence-based practice that can help you reduce the chances of developing postpartum depression or tackle your postpartum depression if you're already going through it. And that is CBT, cognitive behavioral therapy, a very popular approach in therapy. I practice this approach with my clients in therapy. And by the way, if you need a therapist, if you need support, and if you want to learn more about how to apply this skill in your life, feel free to send me an email. I'll put it in the description down below so we can try and plan for a free consultation and see if there's any way that I can help you. If you're not ready for therapy, just make sure to subscribe to my channel so you can continue to follow up with these videos that I'll be making on how to improve your mental health. Nonetheless, if you're currently struggling with postpartum depression, I really recommend that you do something about it. Postpartum depression is not fun for you, it's not fun for your baby, it's not fun for any member of your family. But anyways, going back to our topic, why CBT? Well, there have been several studies that link a positive correlation between CBT and reducing postpartum depression. A particular study included 150 pregnant women who were at high risk of postpartum depression. The women were randomly assigned to either a treatment group or a control group. The group program that included CBT skills was effective in reducing the risk of postpartum depression. And again, these were all women at high risk of developing postpartum depression. I'm one of them because I've been diagnosed with PMDD in the past, so I take this topic very serious. But how can you practice CBT on your own? I'll give you some steps to follow. A very common CBT technique is to first identify negative thinking, and second, to change the narrative or the dialogue of that negative thinking. But to do this, you must become very mindful and self-aware of your self-talk. For example, you may think, I'm not ready to be a mom, I doubt my ability to be a good mother, I'm a terrible mom, or I'm scared to be a mom, I can't do this, I don't like my body. Once you have identified that this self-talk is happening in the background, you have to try and catch it, right? Grasp it. I recommend that you share these thoughts with someone or you write them down so you can make them feel more tangible and real. And once you've done that, you can go to the next step, which is trying to reframe that content. I don't want you to go full-blown positive and, make it Disneyland. I want you to stay realistic and neutral, but definitely not negative. I like to use this formula to creating neutral statements, and it starts with, although I have fears about being a mother, nonetheless, I know I have good intentions. Or although I have fears about being a mother, nonetheless, I know I'm doing my best. Or although I have fears about being a mother, nonetheless, I'm trying to educate myself as much as I can. As you see, it starts with the negative thought that you're having. It acknowledges it, it validates it, but then it also has a switch there of trying to stay neutral and instilling some hope. If you're an optimist and if it's easy for you to be positive, then use positive affirmations. Some examples can be, I am capable and strong enough to handle the challenges of motherhood. I am enough as I am. I love myself. I can do this. Next, we're going to focus on problem solving. Try to tackle the specific insecurities that you're having about motherhood or the problems that you're having with the changes that your body's going through or that your life is going through. And then find the help that you need. Use your creativity, use your resources, and try to make changes in your life or to improve your knowledge if that's what you have to do. Some examples include taking a course on parenting, taking a course on preparation for labor, developing clear strategies and plans to share with your partner. So if you want to go on a feeding plan, a sleep plan, if you have expectations from your partner, put it all in a Word document and print it out and have a conversation about it. But the point I want to get to is that we need to stop dwelling on the problems that we have and feeling like they're a big impossible mountain to climb, because yes, that's how things feel during pregnancy. Let's stop dwelling on this problem and making it a monster, and let's start taking action. Another useful CBT strategy is to keep track of things. So a mood tracker may come in handy for you. I like to use a diary or app in my phone that I try to update weekly. I'm not gonna lie and say that I do it religiously every day because I am busy and sometimes I am tired or sometimes I forget, but I do try to keep track of my mood weekly. Why is the mood tracker helpful? It helps me keep track of how I'm feeling. Sometimes I do make sense of my emotional problems because I'm like, oh, all of these changes have been happening in my life. That's why I'm feeling this way. It helps with validation, reassurance, and it also helps you to identify patterns and triggers so you become more proactive about what you're doing to help yourself. Behavioral activation. I love this technique. Increasing enjoyable and rewarding activities to help lift your mood and create some endorphins is key when it comes to helping you with depression and low mood. This can go all the way from exercise to building a puzzle, cooking, or engaging in any activity that requires an involvement of your senses and presence, bringing you a sense of joy. Self-care. When you do good things for yourself, you feel good. Focus on you. Who are you? What do you like? What do you enjoy? You have to try and use self-care as your medicine. So I know that I have my list of things that really make me feel good, and I make sure that I do these things every day because that's going to make me feel better. So at the end of the day, I can say I took my prescription today. I did all these things that really helped me, and therefore I feel better. CBT is huge on doing what works, doing what's best for you. Stay very mindful and self-aware. Paying attention to the present moment in a non-judgmental way can really help you reduce stress and improve well-being. It will also help you be more hands-on and smart about handling the symptoms that you present. What are mindful practices? Well, deep breathing, there's the 5 senses exercise, there's a butterfly hug exercise, body scan. Journaling is a huge one that will help you stay present. So all of these activities are going to help you stay mindful, present, and connected with yourself. Remember, mind, body, and soul are one, but you do have to put in the effort to connect with them. I hope I did a good job at explaining these practical skills that you can use on your day-to-day to help you prevent postpartum depression or tackle postpartum depression if it's happening right now. With nothing left to say, I hope you have a beautiful day, and I'll see you soon in another video.